Hi everybody, my name is Leila P.L. Valete and I am the Health Education Manager here at AiArthritis. I am also a person living with Sjögren's and lupus. And so I am going to be talking to you today about interstitial lung disease, specifically from EULAR 2024. And so as a part of our Go With Us to Conferences series, we are going to be talking about interstitial lung disease, which is not itself an AiArthritis disease, but it is something that may happen as a disease progresses. It can happen in a few different AiArthritis diseases, or it's more common in a few different AiArthritis diseases, and I'll be going into that. The specific session that we are going to be talking about from EULAR 2024 is called Interstitial Lung Disease from Diagnosis to Management. And we're going to be exploring new research on who is at risk, how ILD is diagnosed, and what early intervention can do to help improve outcomes. And so today we're going to break down key takeaways and, most importantly, how you can use this information to advocate for better lung health if you may be at risk or you already have ILD or wherever you may be in your patient journey. And ILD is pretty common in AiArthritis diseases. In systemic sclerosis or scleroderma, up to 47% of patients develop ILD. In rheumatoid arthritis, 11% of patients develop ILD. In Sjögren's disease, roughly about 17% of patients develop ILD. And they talk also about idiopathic inflammatory myositis, which is not an AiArthritis disease. It has more to do with the muscles than it does with the joints. But that rheumatic disease, around 41% of people develop ILD as well. And ILD symptoms, they can often develop very silently without you noticing or developing over time. And so many patients may not realize that their lung involvement has started until it's advanced or till it gets detrimental or you have some kind of emergency situation. And there are a few key risk factors for ILD that they talk about. And these researchers identified several factors that increase the likelihood for developing ILD, which includes aging or being of older age, especially those over 60. Those who are male also develop ILD a little bit more. A history of smoking, and even if you quit years ago, the damage that had happened during that time can make you more at risk for ILD. Also, having a longer disease duration or whenever onset of the disease happened, if you've had the disease for more than 5 years, that can also be a risk factor for developing ILD. For rheumatoid arthritis in particular, there are a few antibodies that also make you more at risk for developing ILD. And for RA, those are anti-CCP and rheumatoid factors. So if you are rheumatoid factor positive, you may be more likely to develop ILD. In scleroderma or systemic sclerosis, the antibody that may show that you may be more at risk for developing ILD is anti-topoisomerase 1, anti-topoisomerase. And in Sjögren's disease, it's anti-Rho52 and anti-Rho60. And also some other symptoms that may happen that would make you more at risk for developing ILD is mechanics hands, arthritis activity or joint pain and inflammation, as well as skin changes. And that may be more specific to scleroderma. And of course, like we said, early screening and diagnosis is very critical, but also once this does develop, there is a lot of treatment and management that goes into it. Not all ILD progresses the same way. In some cases, it may remain mild the whole time, and others it may worsen very quickly. And the research EULAR 2024 highlighted that anti-fibrotic medications may help slow lung scarring. Immunosuppressive treatments play a role in managing inflammation, as they do with all of our diseases, and regular monitoring is essential. Even mild ILD can increase mortality risk. And the takeaway is ILD treatment is becoming more personalized based on patients' risk factor and disease activity. Of course, there are ILD EULAR and ACR guidelines that are also there for you to take a look at and see if your doctor is going by those, or if you'd like to suggest using the ACR or EULAR guidelines for diagnosis and treatment. We also wanted to talk about how patients can take this information and how it can impact their healthcare. That's one of our biggest things with this Go With Us program, is we do want to disseminate all of the research information to you and help educate you on that research. But we also want to take the time to make sure to let you know how you can use this information in practice, in your everyday life, in your patient journey, in your healthcare management. And so if you have any AiArthritis disease, ILD, or lung involvement in general should be on your radar. Many patients don't connect lung symptoms to their arthritis or their AiArthritis disease until it's too late. Looking out for persistent cough, shortness of breath, unexplained fatigue can be really early warning signs. And of course, it can be hard when you do have a lot of other things going on with your AiArthritis disease, but keeping a lookout for those symptoms is very important. And make sure to talk to your doctor about screening, even if you don't have symptoms yet. If you have multiple risk factors, ask about getting HRCT and pulmonary function tests just to see what's going on and have a baseline of what those are, so that maybe if any type of symptoms develop in the future, you can go back to those to see what the baseline is. And don't wait for symptoms to appear. Early detection, again, means better outcomes. Make sure to monitor your health. Make sure to monitor your lung health over time. If you already have mild ILD, regular checkups are crucial to track progression. Consider lifestyle adjustments that support lung health, like stopping smoking, staying active, and staying away from any environmental triggers that you may have for your ILD. Like any AiArthritis disease, it is so important to make sure to be proactive in creating your treatment plan with your doctor or having shared decision making. Make sure that whatever therapy or whatever medication that you decide with your doctor is something that you can stick to, something that you are comfortable with, and something that you know is something that can help with your disease, and that you make that decision together and not just being told what to take. You can also ask if new therapies like antifibrotics might be right for you. And make sure that you and your rheumatologist and your pulmonologist communicate about your plan. That can be very tough to make sure that your rheumatologist and pulmonologist communicate. There are ways to get them connected, whether it be through email, through MyChart, or other systems that may be easier to communicate with, or even if you have to print out the notes yourself to bring to either doctor. Just having their notes and their information is super important. And of course, helping to spread awareness like we are with this video is super important, just to make sure that patients know about their risk for ILD. I feel like many patients really don't know that ILD is a risk for some of these diseases that we mentioned, like RA, scleroderma, and Sjögren's. And make sure that if you hear about someone that you may be talking to that has one of those AiArthritis diseases, and they're talking about shortness of breath or anything like that, just letting them know, like, oh, you should check out some information about ILD. And yeah, arthritis, we just came up at AiArthritis. We are developing an ILD guide for patients to be able to take a look at with ILD, specifically with rheumatoid arthritis. But of course, that information can be used for any other AiArthritis disease as well. So if you go to aiarthritis.org/ILD, you will be able to find more information about our patient guide and all the other resources that we have on that page for ILD. And with this research from EULAR 2024, it reinforces how ILD can significantly impact patients with autoimmune and autoinflammatory arthritis. Of course, the more you know, the better you can advocate for early detection and proper care for yourself. And if this video helped you, stay tuned for our next Go With Us. We do these Go With Us videos for all ACR and all EULARs. And we would love for you to join us and be a part of our group and come with us to these conferences. And if not, take a look at our other videos that we have on this page about any of the other interests that you may have in updated research in AiArthritis diseases. Thank you so much for your attention and for listening about ILD from EULAR 2024. And we'll see you next time. Bye.